Venous thromboembolism is a fairly common and can be really dangerous problem. As far as preventing it, we still don't understand a lot about that. Statins may help, or they may not. And the evidence here is exactly that. We're not sure. So we're at ESC 2012. It's a very good day. We have Qudin Nguyen, and we also have Kazim Rahimi. And between the two of you, you have come to rather different conclusions. In just, a Reader's Digest condensed version, what did you find?
We found that for the secondary VTE, or venous thromboembolism, there are statin may help and lower the risk of the second VTE.
And we looked at about 1,000 randomized events from clinical trials of statin versus control or higher statin doses versus standard statin doses, and found that overall there was no statistically significant difference between control and intervention. So there was no large effect, at least. In our study there were more than 100,000 randomized patients, and I said about 1,000 events.
And in yours?
And we have 37,000. And we try to be sure of the diagnosis. So to be put on the VTE, you have to have the outpatient diagnosis for VTE and also have the medication, the prescription for heparin or warfarin.
So what's the answer? How come you two came to very different conclusions?
Well, I can only comment on our work. Generally, if you're looking at modest effect sizes, and that is what statins' effect on VTEs are going to be, if there is any, then usually using observational data may not provide a definitive answer. So that is why we looked at just unrandomized evidence, and collectively we found that there was no such effect as previously reported by, for instance, the Jupiter trial, which suggested, based on limited number of events, that the risk of VTE could be halved by statin prescription. So I think the discrepancy here can be probably at best explained by the designs in studies.
Yeah, that's right, because we have this register-based investigation, and you have to look at the results with cautions.
It does kind of explain why perhaps we've been confused in the past, because the data have been all over the map, it would seem, correct?
Yes, and that continues. Following that sort of literature on statin and VTE as we see it here. But I think probably the best evidence that today exists is evidence from randomized trials, and they suggest that if there was an effect, that effect would be much more modest than previously reported, i.e. in the range of a fifth.
So it's maybe been overstated in the past, and you're finding a much more modest, if any, effort.
Yeah, and that is a common pattern we observe, that highly strikingly positive results are published, and they lead to a series of other studies confirming it, some of them refuting it, and unless we have sufficiently robust evidence from randomized trials looking at it, we don't know for sure.
We have information on both of these trials, these studies, I should say, in CardioSource World News. So take a look at the data for yourself as we summarize these two. And I'm Rick McGuire, the executive editor of CardioSource World News at ESC 2012.